In the last 18 months, the world of women's football has been struck by an epidemic of knee injuries. Top players across the continent were sidelined with ACL and MCL injuries last year. Leah Williamson, Beth Mead, Alexia Putellas, Sam Kerr, Viviana Miedemeier and plenty more, all facing huge spells out. And the question on everyone's lips is why? Former Portsmouth and current Stoneham Ladies player Laura Ingram knows firsthand what it's like to deal with a knee injury when she suffered an MCL strain last summer.
When I initially did it, it hurt and I knew I had done something wrong. It's kind of like a really sharp pull. It hurt in the instant that it happened and ached, and it's been constant ache since then. And then when I redid it again, that was worse. That hurt a lot more. You can start feeling a bit isolated from the squad, especially when you miss out on match days. You might get there for kick-off, but everyone else gets there for warm-up, so you miss on those little bits, or away travel. You miss out on coach journey sometimes, although they've been really good and allowed injured players to come along, coaches and stuff like that, so that's great, and it has helped them in those occasions. But yeah, it's not been fun because exercise is my outlet for a lot of things, and so when you're stuck there not being able to move or run or walk properly, it does really make you feel very old. It really can bring you down a little bit. Make sure you have a good support network. That doesn't have to be people in the team. I think it's beneficial if you have people in the team that can support you as well, but also making sure you have people you can talk to and you can lean on, because it's always really important to have that sort of side. Don't go back too early on it. When you think you're ready for it, you're not. Take an extra week or so off and just make sure you really are being patient with it, because so many people re-injure their knees within first 2 years. Everyone's much more likely to re-injure their ACL and knees if they're not properly rehabbed. So it's really have to be careful and really be patient and just do the time.
The topic of women's knee injuries has become so serious, part-time clubs such as Stoneham Ladies have made changes to try and protect their female players. Physio and conditioning coach Martin Joy has recently been given the task of doing what he can to support the female players at Stoneham.
I was brought in about a season ago to work with the 23s, the men's side, and since then I've progressed to working with the men's first team, and also me and Chairman at the start of this season had a conversation. I thought it'd be a good idea to bring myself onto the women's side as well. It was just for a general conversation, so it was all about how can we mitigate injuries in the club. What I'd say is generally for a club like ours, it's all about can we warm the players up properly, can we cool them down, and are they stretching away? So I'd say generally how you prepare a player generally to not be injured is a good starting base to help prevent ACL injuries. But also on top of that, focusing on movements such as landing, jumping, change of direction, all movements could be high risk for where an ACL injury could occur. Getting players to practice that so they're used to it, so that when it occurs in a game, they're not going to be doing something they haven't done before and potentially causing injury. You're looking at maybe a season out, if not more, depending on when they can get surgery, how severe the injury is. Then you've got also the rehab on top of that, especially for a part-time player. It can affect their work away from football. So a lot of people focus on how it affects a professional footballer at the top of the game. That would just be them out. They've got all the facilities available to them. For a player like ours here at Stoneham, if say we had an ACL injury, it's not only going to affect them not being able to play football. If they do a manual job, it could affect them at work. So it really can affect a player's career both in and out of football.
Now, what is an ACL injury? The ACL stands for anterior cruciate ligament. Its purpose is one of 4 ligaments that join your shin bone and your thigh bone, keeping your knee stable. Most people experience a popping sound when the ligament tears. It takes months of physiotherapy to heal, and in some cases, reconstructive surgery. Marek Chiladsky is an experienced physiotherapist at Physio Southampton. He helps treat clients with knee injuries on a regular basis.
So you've got ligaments on both sides of your knee, and they really are responsible for the stability of your knee. So obviously it's really important in different sports and for our walking and gait. So very often I do ultrasound scanning, I scan ligaments, but I do clinical assessment as well. I check the stability of the knee, I check for any sort of palpation can give you a lot of information as well. But you check if there is any sort of problem with the stability in the knee clinically. But also as a sonographer I use ultrasound, and I really like scanning because you can see the connection if there is a continuity of the tissue, if there is a problem with the insertion or origin of the ligament to the femur or to the tibia. So it is like that, and it's really important to get things right, because obviously you've got different grading for different problems within the ligament. You can have grade 1 and your management probably will be different than in ligament injury with the grade of 3. So it's of the full rupture. So it all depends really. So we like scanning, and obviously it's important for the pain to settle and for the patients to have less pain and the swelling to be less, and then we concentrate, and so it's the pain control to start off with, and then isometric exercises. Then slowly we introduce exercises that are good to increase the range of movement, and then slowly but surely we just increase the other things. We work on other things like the strength and but it takes time. Rehab in ligaments injury can take a long time, and the pain can stay with patient for a long time too. It's difficult in a way because there is not much you can do with the ligaments as such. You can increase the strength of your muscles around the knee, you can increase the stability. There are some exercises improving the stability of your knee, but it's difficult to prevent any injuries because we can't affect the play of football or what's happening on the pitch or what's happening on the ski slope. So in a way it's difficult, but it's just getting the right equipment, like for skiing, thinking about the right exercises to be introduced to increase the stability of the knee and coordination, and also I would say it's loading the training in the right way. So if you haven't been training for a long time and you straight away go and play for 90 minutes, probably it's not a good idea. So it's the preparation of an athlete that is, I think, important.
In the community, there are a range of reasons and theories as to why these injuries occur so often to women. One interesting theory is the design of boot that plays a role in women feeling discomfort in footwear that have been predominantly designed around the male foot, not accounting for biological gender differences. Ida Sports is an American startup boot company that focuses on designing shoes for the woman's foot, helping to prevent injury and promote comfort. Emilia Fennell is the lead of sports science at Ida and believes the importance of a good football boot is paramount to peak performance.
So there are slight differences between male and female feet. So one difference is female feet, the kind of ratio of the width at the ball of the foot versus the heel of the foot is different. So in comparison to a men's foot, a women's foot is slightly wider at the forefoot, so at the ball, just before where your toes are, and a bit narrower at the heel in comparison to a man's foot. So that's one difference. Another one's kind of arch height, the kind of location of your fifth metatarsal is the scientific term, basically your pinky toe. So the base of your pinky toe, where that's located, is slightly different. So a lot of women feel when they wear unisex or men's shoes, quite a bit of pinching at that pinky toe. So it feels like there's just this pressure on that pinky toe, and it's because the width is in a slightly different location. So you can allow for kind of that with a female-specific design as well. So that's kind of the core of the female boot. So we use our own custom Ida female last to make our boots. And that's, a huge difference because it's kind of what gives the athlete the greatest sense of comfort. And comfort's known to directly impact performance as well. So if you think about it, like comfort equals performance and also equals like confidence and injury risk. Because if you're kind of more comfortable, you're not gonna be thinking about your feet, you're gonna be able to perform better, you know, think about the ball, not the pain in your feet. And then you can also be like more confident, and such a big impact or a big risk factor for injury is that confidence level as well. So if you're more confident, you're less likely to kind of injure yourself.
This topic has been discussed more than ever in the last year, and after countless calls from fans, players and doctors, UEFA launched a new initiative last month to research the cause of these countless injuries. This means that over the next few years, with a bit of luck, women's football will be able to flourish, with the best players in the game not on the injury table, but out on the football.